Hi, Walt Fritz here, Foundations in Manual Therapy Seminars. I was teaching an advanced voice and swallowing disorders class this past weekend in Florida, and I came upon an analogy that I really kind of became fond of and probably overused to all those poor folks at that class. But when I'm evaluating and treating, this patient-centered shared decision-making model I use is one where instead of me dictating to the patient what's wrong with them and what should be done, there's sharing. We go back and forth. Shared decision making involves them calling the shots as well as me, sharing as well as any relationship can in an equal manner those decisions. And very often when we're working in the face, in the neck, wherever it is we're working, there's an exploration. And often I will say to them, well, does this feel useful? Does this feel like it might be helpful? And often the patient is a little bit, well, I don't really know. I have no idea if it'll be helpful. I don't know what to compare it to. And I realize that I do a lot of comparing. Before I actually ask them for that sort of input, I'll often give them a variety of feelings so that they know there's options. As we move around this mouth area, this face area, letting them know that all these sorts of inputs are possible, doing it slowly to give them time to compare what they feel now to the past, their priors to the present, that sort of thing. And let them, have some sort of idea what it is that's possible for them. And I kind of view this from the analogy perspective as going to a buffet, a big buffet with all sorts of food choices. Before I commit to something in the beginning of that buffet, I want to see what else is down there. All right. So, I might peruse that buffet before touching a spoon or filling my plate or anything like that. So I can say, okay, I don't want to waste my time and fullness on something down there if there's something over there I really want. And I think there's a similar way that I work with patients in that we basically give them an opportunity to feel a variety of inputs, a variety of exposures, variety of directions, pressures, intensities, contexts, everything. Let them feel a variety of things before I ask them to commit. And by the way, when they commit, they can change their mind at any time. For instance, if they've got something going on in this part of their face, weakness, spasticity, fibrotic changes, if we move into that space and begin not manipulating it, but moving, stretching, impacting, allowing them to feel, and basically then giving them a broader choice of the options along that buffet, I think we might be better served than simply saying, putting our hands on them, stretching it, said, does this feel useful? Does this feel helpful? So let's work with that buffet instead of just, giving them what's on the beginning of that line. Thanks for sharing, or thanks for joining me.